Another very common sports injury, unfortunately, can be a shoulder dislocation. We see that in wrestlers and in basketball players, but it can be anybody who falls. The shoulder is the most dislocated joint we have. When the shoulder is dislocated, oftentimes the ball that is dislocated from the socket, there's a ring of tissue. That tissue is called the labrum, and that is very commonly injured when the shoulder is dislocated. Oftentimes, once that labrum has been compromised by the dislocation, there's a chance that the ball is going to continue to dislocate, and so recurrence is a concern. In a young athlete, if they're going to continue to play that sport, surgery sometimes is the better option for them to repair that labral tissue to reduce the risk of recurrent dislocation. For some patients, surgery isn't the right choice, and patients can go through a course of physical therapy and often recover from a shoulder dislocation, and it is not always necessary to perform surgery. Most patients, though, with that injury will require some time away from their sport. We want to make sure that patients are fully recovered, whether that's surgical or non-surgical, and that makes a big difference in terms of how they return. If those patients who have a shoulder dislocation and a labral tear require surgical intervention, we will do that arthroscopically typically, which is making small incisions around the shoulder. We go in with a camera, we'll assess that labral tissue, we look and inspect the rest of the joint, and when we repair this, we use small suture anchors to put into the bone and then repair that labral tissue back to the edge of the socket. Those are done as outpatient surgeries. The surgery takes anywhere from an hour and a half to an hour. Patients are sent home the day of surgery in a sling, and most patients will be in that sling for a period of mobilization afterwards. And that can range depending on how much tissue is involved and how elaborate the surgery is. Some patients are in that sling for 4 weeks, and others for a little bit longer, sometimes 6 weeks. After that period of immobilization, we will start physical therapy, and patients will go through a period of physical therapy that will include restoring range of motion of the shoulder and then strengthening the muscles around the shoulder, which is really critical for getting athletes back to sports. We want to make sure that shoulder is rehabbed correctly so that there's not a vulnerability for re-injury.